Hello, my name is Joanne Seargent, and welcome to Choose Health. We have often experienced loved ones being discharged from a hospital and really struggling with what to do when they need aftercare. So today our program is going to feature two special guests who are going to talk to us about how to handle those difficult situations safely and effectively. So I'd like to welcome you both to the program.
Thank
so
you.
I'd like to start with you. Tell me a little bit about your organization and how you got started in it.
We're coming from Prestige Healthcare Services, and we really think to have this opportunity to explain about our services as well. So the idea started out of helping people. I've always been passionate in helping people and making sure that families are well taken care of when it comes to their health, their loved ones' health as well. So that has been a picture in my life, and I wanted to fulfill that as part of one thing I wanted to succeed in life. So helping people was the idea from the very beginning. I do understand every time, once in a life, someone somehow will need a help from someone else. So that will just get to help people, and just being part of that, will actually, easy people's life, the environment they're going through. It's different people that are getting into during their late ages sometimes, or during whatever that may happen to them, they will need somehow some care home.
Exactly.
It doesn't really matter, it's been a military general or a president. Sometimes they will need, some help somehow at home.
Exactly.
Yeah.
And I think too, when you're that family member and you're getting ready to receive that person back into their home, again, it gets complicated because you have a job and you have children, and then how do you make this transition to home safe? So Malia, in your experience, how do you go about assessing a client when they get discharged?
So I am the clinical liaison nurse for the organization. And my role is to make sure that I'm working with the doctors and with the facilities to ensure a safe transition from the facility into the home. So when we first go into the home, we are not only assessing just the patient, but we're assessing their environment. We're assessing the safety of both the environment, but also the emergency preparedness. So is the family member going to be safe if there is environmental situations that occur, such as a blizzard? Are they going to have running water? Are they going to have adequate support to be able to shovel out in case they do have to get out in an emergency? Are they going to have food supplies, healthy, clean running water, things like that? So it's not just about the patient's physical well-being, it becomes about their overall well-being. It's a holistic approach to providing care. And we like to work not only with the patients directly, but it's important that the entire family is involved in the care, just to ensure that not only are we meeting their physical needs, but again, we want to make sure that we're staying consistent with their daily regimens, that we're sensitive to their cultural needs, that we're maintaining their daily schedule as close to their routine as possible.
Sure.
Because again, that's what's going to be best for the patient.
Sure. So I know, having visited your website, you offer a number of different services. So speak to me a little bit about what different types of things you can offer a number of different clients.
There is a range of services that we can offer to the clients, beginning from skilled nursing. A person is coming, home with services ordered, through their doctors. We're there. We'll be there to help them maintain and just going through the entire process of healing up and becoming well, and ending up being more independent. There is physical therapy. We're providing all sort of therapies, from physical therapy, occupational therapy, speech therapy. All those services we carry with us. We're also having a staff, medical social worker staff in in our services, and our target is actually to help people and reaching out, straight to the people and making sure that they are having all resources that they can, receive from us. There will be well taken care of, just as anyone. Or I would really like to treat any of my parents or any of my relatives who will probably be sick at home and they need care.
Right.
Malia, you can add this.
So additionally, we offer home health aides, which is a huge part of our population that we serve. So those services would include simple things such as bathing that people are no longer able to perform on their own, dressing, cooking, light cleaning, things of that nature that family members aren't able to support on a daily basis. So it offers some assistance to both the patient but the family as well. It's added support.
Right.
We also have an adult foster care program. So this particular program allows loved ones to be compensated for providing services if their loved one lives with them within the home. There are certain criteria that must be met in order to qualify for this program, but it's a way to keep your loved ones within the home, be able to provide that personal service to your family member, and keep them safe.
I was familiar with that, and it's interesting that you say that we have that in Massachusetts. I remember once having a coworker who had a family member in Maine, and she said, "Do you know that I could stay home and take care of my mother and get paid for it?" And I thought, wow, that's interesting. So
Right.
you're saying that there's a similar program to that in Massachusetts?
Yes.
Yes.
Interesting.
Yes.
Huh. Now, when someone is in need of services, whatever it is, speech therapy, occupational therapy, who determines the length of services that is needed? Is it a collaboration with you and the physicians? How do you make that determination?
So it's a process. So what happens is whether it's a person who feels that they need services and they self-refer, whether it's a physician who refers a patient, whether it's a hospital or rehab that refers the patient to us, we first get the referral, we process the referral. Once we have that, we have a licensed nurse who goes into the home and does a full physical assessment as well as an environmental assessment. And from there, they come up with a treatment plan. They may make recommendations and work directly with the primary care provider to establish a regimen for that patient. So if there is a home health aide who may be working, they will have a care plan directly written by the licensed nurse to follow. And again, the skilled nurse would be teaching and working directly with the patient and the doctor towards the goal of hopefully rehabbing them as close to their baseline as possible, and eventually possibly working towards discharging that patient with the resources that they need to be providing care to themselves.
Sure. And do you have sort of statistics on, it could be 3 months, it could be 2 weeks? Is there some subset of time that?
So that would depend on if it was an acute injury, such as a fall with a fractured hip that just needs to be rehabbed. That could be something, maybe 8 weeks. But whereas something like a COPD diagnosis, which is a pulmonary condition that's a lifelong condition, that may be someone who's with us for several months to even possibly years, depending on their mental capabilities and the ability to learn the material. And again, we just want to make sure that they're safe in the home. We would be obviously assessing their ability to take their medications, to recognize signs and symptoms of complications, and when they need to call the doctor versus call 911 or get help immediately. So it's something that we will be actively working with the patient to assess and again reassess.
Sure.
But again, it can be something as short as 2 months, and it could be years,
More
depending on
extended.
this situation.
Sure.
So,
You mentioned a couple times, the word safety, and I remember once working with a home care agency, and the nurse went in to do an assessment, and what was happening is that the caregivers were getting injured.
Right.
And someone went in and did a home evaluation and said, this person needs, and in this particular example, it was like a Hoyer lift. I don't
Right.
even know if they call them Hoyer lifts anymore. And said to the family, you need to get one of these because our staff is getting injured. So I think that as we talk about the safety for the person that we're taking care of, I'm sure you have those considerations for your staff as well.
Absolutely.
Absolutely. That's another area that we've always been, trying to make sure that, as we are providing care, we're also taking care of our staff and just making sure that they do have all the equipments they need. We would really like, to treat and, try to help people managing their diseases and whatever that, hinders them. And not really trying to make one, another patient out of that. So we'll always try to make sure that, we are making all of our safety is our number one, issue, and teaching our employees time to time and making sure that they know how to take, safety, precautions before they are taking care of, any patient. So that is our priority as well.
Sure.
Yes.
I understand that totally. Now, you mentioned how individuals might reach out to you for referral. So would it be fair to say that there's a population out there where health insurance will pay for a subset of these services?
Absolutely. We're actively working with Mass Health, Medicare, Medicaid, and insurance is changing every day. We actively work every single day to get new contracts. So that's something, if anyone has any questions regarding insurance, we would encourage them to contact our office because, again, that is something that we're updating regularly.
Right. No, I think we're all understanding and appreciative of that. But I think you're right. As people are trying to identify various services around, I think the first logical question comes into their mind, can I afford this? And will my insurance company work with me? And obviously you're in the business to provide a service, but at the same time you need to be compensated for it. So I think a lot of people would just be happy to know that a lot of these services are going to be covered by insurance, and then you sort of reassess and go from there. I'm sure. So I know you mentioned earlier about your adult daycare program. That's interesting to me because not everyone needs an assisted living at certain points in their life or long-term care. So what type of an individual would be a good candidate for your adult program?
So it's actually the adult foster care.
Foster care.
Any individual that is 18 years and above that qualifies and may qualify for the service. There is levels. There is an involvement of a nurse going in and assess the requirement. Is the person meeting the requirement under the regulations of myself? So. Because majority of services are getting paid by myself. Now, based on that assessment of the nurse, will determine actually what level is the person qualifies for it. So we have to do the screening ahead of time, and if a person qualifies for it directly, then the nurse will just get to assess that, send that to the doctor for a doctor's confirmation and having the actual doctor order, and from there we will start the processing.
So adult foster, so essentially that can be a self-referral as well as someone else referring them into the program?
Right.
Okay.
Yes.
So anyone who has any chronic illness or any type of disability that prevents them from taking care of their daily functions. So if they have any trouble with bathing, dressing, cooking, cleaning, anything that they're not able to do independently, but they have a loved one who helps them out on a daily basis who lives in the home, would qualify and be a good candidate to come on board for that program.
Right.
For example, my grandmother would have qualified for those services as she ages, and if she's unable to cook and clean for herself, bathe, and if she has a loved one who is living in the home, who would be taking care of those basic needs on a daily basis, they would be able to be compensated for that.
Okay.
So
so that's part of the foster program.
yes.
So it's really, and so if you didn't have a loved one or a family member, then you could still provide someone in that role, or is the foster program really for family members?
We would be able to provide someone from the organization
Right.
who would be able to help
Sure.
that person out as
Sure.
well.
You know, I have a friend, and recently, her mom was aging, and they really wanted to keep her at home, and they just felt that that's where she needed to be, and so they had 24/7 care, and even had someone sleeping over. I mean, that's all that person did at that juncture, but it gave the family peace of mind to know that she was home in her environment, even though she was sort of in and out of knowing where she was. For the family, it was reassuring, and I think in this day and age, a lot of times we as caregivers, we're supermen or superwomen, and we have our limitations, and I think that very often it's the caregivers that become forgotten and try and take on too much. So I think it's okay for people to say, I need to reach out to an organization such as yours to just enlist in some services to just help everyone, really.
Right.
Yes, and oftentimes we find that if someone comes to us for help and they don't quite meet the criteria for one program, we're able to fit them into another program, and they'll qualify for another one of our programs. But we are at Prestige very much about trying to find something that works.
Right.
So
not so cookie cutter,
exactly.
willing to think outside of the box
Yes.
a little bit,
Right.
which is great.
Yes.
I mean, because everybody has different circumstances, and to know that you can be somewhat flexible, accommodating, yet within certain criteria and guideline, as I'm sure. And you mentioned something too, which is interesting, where you mentioned Mass Health, pays a lot of these services. When you stop and think about, if it wasn't for organizations like yours, for example, some of these individuals would have to be in more costly environments, whether it be in an institution, in something. And so I think that because you can step up and you can offer the services that you do, for Mass Health, for example, is a huge cost-effective way of taking care of these individuals.
Right.
And I don't know, do you have a population of individuals that need psychiatric monitoring, or?
Yes, we actually do. You're going to add some more on that. We do have well-experienced nurses that have experience into psychiatric issues. We do know exactly. I mean, this population somehow is not really cared. To the extent that it's supposed to. A whole lot of problems and issues arising most of the time, and people are actually finding themselves into much of problems. Now we do have nurses that are really experienced, and they start from those people who are COPD, just like what Malia has mentioned. Dementia patient. That type of people that need really psychiatric observation on daily basis, medication, monitoring. We do all of that. Malia, you can just chip into that.
So the
too.
mental status checks that we are able to perform are essential to patients who have psychiatric conditions that may not be able to receive treatment in other facilities, or may not be able to make doctor's appointments on a regular basis. We have nurses who are able to go into the homes and administer medications. The medication can be kept in the home. using a lockbox so that it offers a level of control similar to if the patient was going into a doctor's office every day to receive their medication. And again, we have various nurses who are trained and specialized in multiple areas. So it's
Yeah. I mean, it's fascinating to me too, because again, that's such a population that for years really they had very few options, and I think the type of services that you offer with the skill set that you can offer them is very valuable, and I'm sure for the families as well as for the individuals themselves offers some peace of mind.
absolutely.
I'm sure.
Yeah, that's
Now, in your industry, I'm sure you have a lot of stories to tell, but can you share with me just a story, especially you, Malia, given that you are a nurse, but that that really you made a difference in either someone's life or someone's family? I'm sure you have a lot of them, but can you just think of one in particular?
Well, I can think right off the top of my head of one situation where we were thanked profusely by a family. It was actually a home health aide who was going into the home every day, and the patient was noticed to have an asymmetrical face. So she noticed the lip was drooping on her patient and was able to get her to the emergency room. The patient was admitted with a diagnosis of a stroke. So something like that has such a significant impact on a person's life. I mean, it's just great to hear those stories from our home health aides, from the families, because that's why we do what we do, is to take care of people, to do the right thing, and to make a difference.
Right. And especially, as you point out, in training and education on your part, and continuing to assess your staff too. But good for that home health aide to be able to recognize those signs and symptoms and to catch it maybe a little bit on the earlier side rather than maybe a worsening of the condition. So I think having your staff be alert to those types of things is certainly good, feel-good stories, and makes you feel good, I'm sure, as an owner, to know that they're doing the right thing and it was a good outcome all around.
Right.
Yeah.
I mean, we do have multiple of these stories, but we're real thankful for the staff and people that are dedicated to providing care, and the best care that we're providing is actually going to affect people's lives down in the homes, in actual homes, giving people rest from all the headaches and running trying to take care of mom or grandmother. And just having that free, life and just, having a family moment. So we can be there to help people and ease them out from this tough, living, situation. It's a couple of studies I believe, people have researched and realized that, majority of families that are taking care of their loved ones, they are actually getting affected in different ways in their lives, missing time with, spending, with their family members, or crises within the families and stuff like that. So we're there to help them.
That's great.
Yes.
Well, clearly, you're a much needed service, and I know you have an office corporately based in Worcester, and you have one in Lowell. So if anyone out in the audience, wants more information, we have certainly the website available for them to look at that. And I really appreciate both of you coming today just to share a bit about your organization and how you make a difference in people's lives, not only the people that you deliver care for, but the people that are the family members who stress over these types of things. So again, I want to thank you both very much for taking the time to be with us today, and I'm sure the audience will get a lot of really good information and some peace of mind to know that there are services out there that they can reach out to. So thank you very much.
Thank you
for having us.
You're
Thank you
welcome.
for having us.
Welcome.